Welcome to Think Bigger Voices, hosted by Jennie Treby and co-produced by Tony DiBenedetto. We're on a mission to break the cycle of poverty for kids in America by inspiring education, advocacy, and action in our communities. We'll tackle big subjects, talk to the experts, and promote the solutions making an impact. Join us if you believe that every kid deserves the opportunity to think bigger.
Welcome to Think Bigger Voices. I'm Jennie Treby. Today, we're talking to two experts in healthcare, wellness, and disease prevention. Tampa General Hospital is at the helm of tackling healthcare disparities, and here to help us understand the trends and a big solution are Dr. Tanuja Sharma and Ms. Rachel Hoyer. Ladies, welcome, and thank you for joining us.
Thank you for having us.
This is a big topic. As we all know, we were just talking about healthcare we could go on for days and days. Mm-hmm. But what we're really focused in on, especially through our podcast, is what we're calling underserved communities and populations. Mm-hmm. And so just to clarify, we're talking about kids and families who are below or at the poverty line or even above the poverty line. And of course, the data and the research are showing us that over 40% of the population is really struggling to make ends meet. Mm-hmm. So this is a big population. So, this is a big thing to tackle, and we're so happy to have you both here to help us kind of unpack that a little bit. So, Dr. Sharma, I'm going to start with you first.
Sure.
In your practice, what are you seeing? What are some of the trends that we're seeing, especially with our kids?
So for our kids in this specific population that, are meeting just ends meet, this population in general, there are issues with just higher costs for insurance coverage, or they're underinsured. And when you don't have insurance or you don't have access to all of the providers, you are at increased risk of missing continuity of care visits, screening, exams, immunizations. And so if you don't have a regular PCP, that go-to healthcare provider that you can go to for all your needs on a regular basis, you're relying more on urgent care visits and ER visits, and those are more costly, and you're missing those screening tests. And so if you miss your screening tests, you're getting a chronic disease or a condition that might not be a big deal initially that ends up snowballing and becoming an issue that's bigger later. And you're also missing out on vaccinations and those immunizations. So now you're at increased risk for the flu if you haven't gotten your flu vaccine. The other big area for kids, especially if you don't go to those wellness visits, you're missing out on screening exams for developmental delays. And so there might be issues with, early intervention or a speech delay or just something simple as needing glasses or hearing aids. And if you don't catch that initially and they're going to school and they're falling even more behind, it becomes, more of an issue. So it's kind of a vicious cycle with having poor access to care, leading to, increased risk of healthcare issues, school outcomes decrease, and that ends up leading to increased cost of, your chronic diseases, which then increases your stressors and costs at home. And it's just kind of a vicious cycle that is so unfortunate.
So it kind of snowballs.
Exactly.
So tell us, what are some of the healthcare issues or diseases or things that you see that are prevalent?
Sure. One example, we're seeing more increase of environmental exposure. So these communities tend to live in older homes and more of an urban setting. So the air quality, their home quality is at increased risk, mold and sometimes lead. And so we're seeing this population a little more increased with asthma and respiratory conditions. Dental care is really expensive in general for everyone. And so we're seeing, increased risk of dental issues, infections, gingivitis, those type of things. And then these families are just barely meeting ends meet, like you mentioned. And so that chronic stress in the home environment from such a young age it's so additive. And it's not that these families and parents don't care about their kids. They care fiercely about their children and their families. They're just working so hard, sometimes 2-3 jobs and shift work. And so there's no real schedule or routine, and kids, need that. So sometimes they're being taken care of by a friend or a neighbor or a grandmother. And it's just really, in pieces. And so that stress and that fragmented care and support at such a young age has been shown to have increased mental health issues, anxiety, trauma as you age. And so it's really unfortunate that they're experiencing these things at such a vulnerable young age in their childhood.
Right. And you just mentioned, the mental health piece, which is a concern for all kids, but especially if you don't have that support system or that preventative care. What about, Rachel, what about issues like obesity and diabetes? Do you think that affects the underserved population more? Or do you see a difference there?
Absolutely. Especially when we think of access. Whether it's access to nutritious foods or access to safe spaces to go outside and play, to get in that physical activity, all those factors are really important when we're looking at, the rise of chronic diseases. Because if you don't have access to those nutritious foods or access to be able to move safely, you're at risk for having that elevated BMI, having some of those elevated risk factors. And I think that absolutely is translating into the numbers that we're seeing, especially when we're looking at these specific populations.
So talk to us a little bit more about home life and school performance and how a lack of proper health care can really impact that.
Sure. So a lot of these children are growing up in homes where there's, chronic stress. And so there might have a single parent or 2 parents in the household that have multiple jobs and have, a disruptive schedule. And so they're not getting that support day to day as much as they need. And so if they don't have that support and they don't have someone to take them to their doctor's visits, or they don't have a ride to the urgent care ER, little things ends up getting, bigger and then more costly. Just something simple, as I mentioned, like wearing glasses to help you see better at school, can be missed. And so those little things can come up. And a patient, example that I'm thinking about right now is, a young kid with borderline pre-diabetes, diabetes, which can easily be treated with, some lifestyle modifications with change in diet and exercise and a little support. But if that goes undiagnosed, or if that gets delayed, the diagnosis gets delayed later, then maybe by the time they eventually make it to the healthcare provider, now it's, full-blown diabetes, which requires not only oral medication, but perhaps insulin as well. And now they need to check their blood sugars, multiple times a day, and it's affected their vision and it affected their, nerves. And so now they have to see specialists, and, it snowballs, and it becomes more costly when, if they had access to whole nutritious foods or a food program or just that education, it could have been really easily, with some effort, of course, resolved.
So, Rachel, what do you see in terms of, let's just take a child who's 8 years old, and then the child's 12 years old, and then 16, and then becomes an early adult. What does that look like with that continuum of care or lack of care as they start to age?
Yeah, I think of if you don't have that initial exposure or education as you continue to grow, or, move into these different milestones or different stages of life, that, if you don't have that education, you're not starting to develop those good habits. And so, thinking of like if you don't have access to those nutritious foods, or maybe you don't have that stable household where you have the family support to cook healthy meals and sit down at the table and share a meal together, as you continue to grow, some of those different social factors become a part of that. So then do you know how to make those healthy choices for yourself as you get older and then potentially eventually move out and become independent? Do you have the skills to be able to cook for yourself? Really then just having that background in education to make those healthy decisions. I mean, I really think that's kind of the trend that you end up seeing then. Mm-hmm. And it's also, then it may not be valued. If that's not a value that you grew up with in your household because you were so focused on seeing your parents or your guardian, meet ends meet. And so you didn't value a structured bedtime, didn't value having after school activities, things like that. I think that really then you see that then as you mature into an adult and are making those different decisions.
And then you can see where it starts to become cyclical, generational then.
Yes, for sure.
Yeah. Mm-hmm. We've kind of set up what the challenges are, and they're big and it's a lot. Mm-hmm. But I want to talk specifically about TampaWell because it's a 3-year-old program now, and I know, Rachel, it's your baby. So tell us a little bit about what TampaWell is and how you are going about providing care for underserved communities.
Yeah. So TampaWell started now just a little bit over 3 years ago in partnership with the city of Tampa. And we really wanted to approach this with more of that grassroots effort. So working with about 100 different organizations now across the Tampa Bay area who have a similar mission or vision in mind that we do. And so our mission with TampaWell is to empower communities and transform lives. And we're focusing on 3 key pillars of movement, nutrition, and access to nutritious foods, and positive mental wellness.
So what was the impetus for this whole initiative?
Yeah, so we actually were partnered with an organization out of Italy. And so they have been really successful in this work. About 20, 25 years ago now, they had a leader who essentially made a call to action to the community saying, hey, our numbers are moving in the wrong direction and we need to do something about this. Chronic diseases are on the rise. Sedentary lifestyles on the rise. And so with that, flash forward to today, they now have this wonderful foundation that is leading the efforts in an area called Romagna. And they have actually named it now Wellness Valley to really just kind of emphasize the great work that they've been doing. And so with their success, the organization wanted to see if it could be replicated. One thing led to another, and they identified Tampa as kind of being a really great area to target. And so we were partnered with them and we said, heck yes, this is right in line with what we're trying to do at TGH, really taking our care beyond the 4 walls of the hospital, looking at our underserved populations, looking at better ways to support our community. So it was a really nice model and group to work with to get this idea started. What's interesting now is, as we know, there's a lot of differences in Italy compared to Florida, for example. And so little things have been tweaked and what has made us successful versus maybe wouldn't have made sense over there. But they've been great to work with. And it's been helpful to also take a successful model and say, hey, this works. So we really should be implementing these types of things.
Dr. Sharma, can you tell us a little bit more about the 3 pillars?
Yeah.
What does that look like?
Absolutely. So we adopted, the pillars of lifestyle medicine as our focus and philosophy for our TampaWell initiatives. And so one of the main pillars is whole nutritious foods. One is stress reduction and mindfulness. The other is exercise. And we actually are doing a 4th pillar too, in that community connection and social connection. And so the food pharmacy, for example, or our food program in our health park location, it's really awesome because it is the same grounds as where you see your provider. So you see your provider, your healthcare provider, and right next to it, we've built this beautiful, there's a community garden, a food pharmacy, a mindfulness lawn, and a children's area.
Oh, wow.
And so it's a really nice area of, whole complete wellness. The garden is beautiful because you get to learn, you can volunteer, you get to learn how your food is grown, the benefits of fruits and vegetables. There's an area for cooking demonstration and classes, so our families can attend these, learn how to cook healthy, simple meals, which I think is so powerful because it's better for, visual learners and just, reading a recipe and seeing it demonstrated and that sense of community involvement as well. And then you have access to our food pharmacy. So people come in, you're a patient at the healthcare practice, you meet with a healthcare provider. And if you meet a screening indication for food insecurity and a specific diagnosis, you will get a prescription and referral to our food pharmacy. And we have 2 different programs, and you basically get free, whole, nutritious food for about 6 months, once a week, and the other program's twice a month for 6 months. And it's not just a prescription for the food. You can think of it as a prescription or a lifeline to whole health because you have access to the garden, you have access to these education classes, you have access to this community. And so it goes more above and beyond just food. And it lasts 6 months, which is enough of a time for you to really see changes, implement these, learn, and see the results of it. So it's really fantastic program. And I love the idea because you're not, it's not a prescription for a pharmaceutical like a statin. It's a prescription for nutritious food. And so that's just one of the, programs that TampaWell is doing in that area. Next to the garden and the food pharmacy is a mindfulness lawn. And it's just an area for our patients and community and team members to just kind of zen out and have some peace and quiet. And we do also offer yoga classes there and, stress reduction workshops there. And I'll let Rachel kind of dive into the kids area because that's a really awesome place too. But again, it's all on the same grounds as where you see your healthcare provider, which is really neat because it just shows the belief and the philosophy of the direction of whole healthcare, comprehensive care, whole mind, body, spirit type of care that we're offering our community and that we're trying to educate everyone about.
It just seems like it makes sense.
It makes sense.
Yeah.
It makes sense.
So Dr. Sharma, tell us a little bit more about the services you're providing around mental health.
Sure. So for the past 3 years now, we are offering the MBSR program. It stands for Mindfulness-Based Stress Reduction. It is a evidence-based program developed by John Kabat-Zinn in the 1970s. And the research shows that it's helpful in chronic diseases, chronic pain, autoimmune conditions, anxiety, PTSD, insomnia. And we know that mental health is on the rise, and this vulnerable population has increased risk and stressors at home. And so it's an 8-week program. We offer it twice a year. There's a virtual and a in-person option from 5:30 to 7:30 in the evening. So we're hoping to capture everyone after work. And you sit and you learn different techniques, stress reduction techniques. You go through a body scan. You go through gentle yoga stretches, and you learn how to meditate. Each week you build on the practices, and you get a little bit of, homework and practices that you do on your own. Towards the middle end, there is an all-day silent retreat, which is really interesting. And people are intimidated by that, but it is just really powerful to sit and meditate and learn these skills. And by the end, we're hoping, and our goal and aim is for everyone to implement these changes in their life and carry it on with them, as long as they could. And like Rachel had mentioned before, having the education and access to populations at a younger age, it just builds those healthy practices. And so I always tell patients, meditation or mindfulness practices doesn't need to look like sitting, cross-legged under a tree like a monk for 60 minutes. You can sprinkle moments of mindfulness in your day that, first sip of your tea or coffee in the morning, or I always take a moment when I'm washing my hands between patients or walking down the hall or mindfully eating. Just grasping these moments during your day and sprinkling them in really helps make those brain connections, and it improves resiliency and the way that you handle stress and your reactions. So you'll learn these tools in our program, and it's the same website of www.tgh.org/mindfulness-based stress reduction, and you'll be able to sign up. Phenomenal program. I did it myself. I finally convinced my husband to do it as well, and he did the virtual class. And it really just helps you learn how to make those neural pathways, those connections, and learn how to meditate and improve your resiliency.
Have you found that people are receptive to it?
Yes, absolutely.
Like once you get over the barrier of I'm not asking you to go and sit cross-legged for 60 minutes.
Exactly. Yeah. I think once we kind of break it down to people, and it is a commitment, it's an 8-week program. And so you have to be able to kind of fit it in and dedicate the time. But once people do, I think it's been so successful. Our classes have been full, and it spreads by word of mouth. And then, through our emails and marketing aspects at TGH. But I think once we break it down, and if people are referred by other patients, it's been really successful.
So, Rachel, before you talk about the kids area, I did want to clarify that the TampaWell is in East Tampa, right? So for our listeners who aren't in Tampa, East Tampa is a really underserved population. Mm-hmm. So it's obviously has been strategically placed so that you can get to the facility, right?
Yeah. So TampaWell really has been designed to support all of the Tampa Bay area. I mean, we have a specific area that we identified that we wanted to start with, but it really encompasses Tampa and Hillsborough County. But that being said, we definitely have that focus in East Tampa with our food pharmacy and our community garden because of really looking at the numbers. We always like to say we make really intentional decisions. We want to make sure that this is not just a Tampa General initiative that's being pushed on the community, but really looking to the community and letting them know what they're looking for. And so with that, looking at the community health needs assessment, looking at what the data shows us, and really looking at that 33610 zip code or East Tampa as being an area of high need. And we said this is a perfect place for us to go in and be able to have that positive impact.
So tell us a little bit more about the kids and how you're serving the kids.
Yes. So the kiddos are awesome. I mean, it's definitely a big piece of what we want to do with TampaWell, whether it's looking at what we're offering in East Tampa or even looking at our partnerships and what we're hoping to do by supporting the school system. But in East Tampa at our garden, we have built a kids area. So we have a playground on site and really kind of taking what we've built for the adults or the community and shrinking it down to kid size. So we have a small version of our garden there where we have miniature garden beds so they can still get their hands in the dirt and learn about gardening. We also have a library on site and some other activities that the kids can get involved with. And so we're really hoping over the next year to elevate our programming there. So partnering with different organizations to make sure that it's kids-friendly programming, such as our after-school program, and family-friendly. So also looking with organizations to bring programming where the whole family can come out and learn. So whether it's mom, dad, grandma, grandpa, guardian, whoever that adult figure is, and then the kids can come together to learn about stress management, to learn about cooking healthy foods, to learn about gardening, but doing it in that family structure.
Tell us, you mentioned after school programming. So what are you doing for after school?
Yeah, so we have a couple different opportunities. In that area, Slide Middle School is right down the street from us. So working really closely with them, as well as some homeschool programs, which has been really fun. And so just providing different opportunities for the older kids to come out and volunteer, whether they're trying to earn their Bright Future hours or, just kind of give back to the community, learn about something new. And then for the younger kids, we're providing different educational opportunities. So things where they can sign up to come out and learn about gardening, for example, or kids-friendly cooking classes, kids-friendly physical activity classes. All those are being offered. We've also partnered with Girl Scouts of West Central Florida to develop a really cool patch program. It's called TampaWell Wellness Warriors. So Girl Scouts can now sign up to participate, and they get to learn about the different pillars of TampaWell while also earning these different badges. And so we have a lot of different troops that are coming out to volunteer or participate in our program. So that way they have the opportunity to earn their badges.
Oh, I love love that. That's great. Can you talk to us a little bit more about the movement part of TampaWell?
Yes. So movement was probably the first pillar we really focused on and honed in on, probably a little selfishly because my background is in exercise physiology. So it was a kind of that natural fit. But with that, couple really cool different things going on. From that community perspective, we've partnered with the city as well as Parks and Rec to really look at the different greenways and trails. We talked a little bit earlier about making sure there's safe spaces for people to go outside and move. And so with this initiative, looking at what currently exists, seeing how we might be able to make improvements and elevate the space, activate it in new ways, as well as looking at where are those opportunities that we can go in and build out safer spaces. So for example, on the improvement side, redoing Bayshore Fitness Trail, adding brand new equipment that had unfortunately been damaged by some of the different storms that have come through, really just kind of beautifying that space, creating exercise videos so people know how to safely use the equipment, and really just kind of market that space in a new way. Then when we think of developing new areas, Woodland Terrace Park is a beautiful space in East Tampa, but same kind of thing as we're, kind of throwing out some of these terms. It was also, kind of underutilized and hadn't seen a lot of attention over the years. And so we worked with the city of Tampa to go in, donate different fitness equipment, really make sure it's also ADA accessible so everyone in the community can access it. We worked with a local artist to paint a beautiful mural to really just add some color to the space. But again, just making this beautiful space that people from the community can safely use and have access to. So that movement piece is so important. And then on the clinical side at TGH, we are offering now our exercise is medicine program. So very similar to our food pharmacy, our food is medicine program, our providers are able to screen our patients for inactivity. So utilizing the physical activity vital sign. Are people moving enough? Are they getting enough minutes in of exercise and the right type of exercise? And if not, they can now receive a prescription to actually participate in a program at our fitness center to have that additional support, to learn about movement, to learn about stretching, to learn about strength training, and have that guidance from a fitness specialist to allow them to really progress and learn more, and then hopefully develop those skills and better behaviors, better habits for the future.
That's really something that you said a prescription. Mm-hmm. Is that actually a written prescription?
Yes.
Like a prescription for exercise?
Yes. So it's really cool. And, I think this is what's been fun working with someone like Dr. Sharma from the clinical perspective is we really want to integrate these programs into the clinical workflow and kind of shift that mindset that nutrition, sleep, stress management, movement should all really be a part of that conversation, not just talking about medicine management, but how can these behaviors really affect your health in a positive way? So with that, leaning into our electronic medical record and really building in these processes to be like what you would see in a traditional clinic. So that way it is a part of that workflow and really encouraging our providers to lean into these programs and utilize them in a unique way.
That first line of defense, are these lifestyle modification. It doesn't matter how, mild your disease is or how advanced it is. These lifestyle modifications are always implemented and always recommended as a part of your regimen, whether you're on medication or not. And so it's the first line of defense. And I'd say to patients often, 80% of what happens in life is preventable. And so obviously 20% could be genetics or accident or some type of trauma, but 80% is something that we can prevent. And so, having that access and getting introduced and educated to all of these programs, and implementing these changes are so important. And TampaWell is just giving Tampa, the community of Tampa, the opportunity and the access and the awareness of making it really easy to capture all of these lifestyle modifications easily. And so one of the aims is just to really make Tampa Bay the wellness city, the healthiest city in the U.S. And so having that access and making it as easy as possible is, one of the goals.
How are you getting the community to come to you? like, obviously you've got these beautiful facilities, but how are you actually getting the families and the kids in to see you?
Yeah. So, I mean, I think it goes back to that word, intentional. And so, for example, when we first started coming up with our strategy of what in the world did we want to do with this platform? What did we want TampaWell to look like? Again, we had, someone like Dr. Sharma around the table helping us with the brainstorming, helping us with the strategy. But we literally went door to door in different communities, introducing ourselves, surveying them to kind of say, hey, if you had unlimited resources, what would you like to see? And really starting to build those connections, especially when we're looking at these underserved communities. Trust is so, so important. And there's a lot of, preconceived notions based off of things that have happened in history of where there's not a lot of trust when it comes to healthcare. So really taking the time to start building that trust and building those relationships, I think has been really helpful, as well as being intentional with our hiring. So we are fortunate enough to have a phenomenal community garden and food pharmacy manager. And Janice is from the East Tampa community. So it's really helpful to have someone that they were already familiar with. So when they may not know who Rachel is, but they know who Janice is and they make that connection, they're like, okay, if I trust Janice, I can trust Rachel, and therefore I can trust TGH. And, it's kind of that positive cycle. So really just making those connections, taking the time to build that trust, to really get them to want to come and engage with us. And that has been really helpful to really increase the engagement with all that we're doing.
How does the insurance or lack thereof or being underinsured play into this?
Yeah, I mean, that is definitely an issue and something that, not only do we want to make an impact in Tampa, but thinking kind of beyond that, almost more like at the national level of, what can we use this platform for? How can we help advocate for change? Because unfortunately, there has not been a lot of value placed on these programs yet. So a lot of it is something that we are funding internally, that, we don't have that traditional reimbursement structure, looking at grants to help us fund these types of programs. So it can be challenging, without kind of that insurance support.
So you talked about, just having more of a national view and the advocacy piece of it. Do you believe that it's repeatable, what you're doing here?
Absolutely. I mean, that is our goal, is, not only kind of repeating what worked well in Italy and bringing it here, but then, tweaking things to make sense for the United States and even more specifically for Florida, but building these successful models that can then be replicated. Because, even though, yes, technically the hospital is a business, we are, and we have competitors, but there are plenty of business out there. We're never going to run out of patients. And at the end of the day, our ultimate goal is to be able to serve our community. So if we can have these successful models, let's replicate it and start making these things the golden standard. So let's make sure not only are we creating access to, different services within our health system, but let's also make sure we're serving our patients by making sure they have transportation to get to us, make sure they have healthy foods to help with the management of their condition and so many other things.
It's truly the hospital's philosophy and belief to really focus on these changes and serve the community and our team members. And so we're lucky to work for an organization that supports it and putting it in its budget and providing these resources for our patients. And absolutely, we would love to share all the hard work that the team has done for, just to continue to serve more people.
Yeah, absolutely. Well, in terms of being able to kind of, prove it out, you're only 3 years old, but do you have any kind of initial results yet, or any kind of, trends that you're seeing to the positive?
Absolutely. So a couple different ways to look at it. One, with Italy being around a little bit longer than us, they have seen some incredible numbers. And so looking at some very similar metrics here, really leaning into the community health needs assessment, which for those that may not be familiar with that, it's an assessment or survey that is sent out to our community every 3 years. And so with that, looking at the data, if we knew when we started these certain health issues were at the top of the list, if you will, looking at them now, are they starting to move? Are we making a dent in some of these numbers? And that is our ultimate goal. But also looking at it kind of program by program and seeing like, okay, we've been able to positively impact over 400 patients in our food pharmacy. That is incredible. We've been able to start lowering blood pressure, A1C numbers, BMI, or your weight. So looking at it kind of in that localized setting with this specific program, and then seeing how that hopefully is translating to those larger numbers across our community or county.
Right. I think we've distributed more than 6,000 pounds of fresh produce to our patients so far, which is just, phenomenal. I really think that having access to nutritious whole food should be a right. And so it shouldn't be, as difficult as it is. And so us being in Health Park and in that, community and giving access to the people that need it most is just phenomenal.
For both of you, what do you see? What's next for TampaWell?
So we have an exciting initiative in the hospital just to show how dedicated we are with this philosophy. But we are working with a world-renowned chef to elevate the food that we serve to our patients. And so the food will not only, be aesthetically more pleasing and beautiful, but in terms of the nutritious value, the ingredients that we use, we're going to use organic produce when possible, no processed ingredients, no seed oil, non-GMO, healthy, nutritious vegetables, fruits, whole grains, you name it. And we're following philosophies of the Mediterranean and anti-inflammatory diet. And so now we'll be feeding, which should be a no-brainer, right? We're a hospital and we're feeding sick people, but we are going to feed them nutritious food that will cure and help improve their illness and their inflammation while they're in the hospital. And so that is a really big initiative that is taking a lot of effort on the back end. We're changing the entire model of how we serve patients. We're having a room service menu. So we're hoping to have less wastage. And I go to patients' room all the time and see, a patient with 6 or 7 little cans of soda on their tray. Why are we giving that or allowing that to patients in the hospital? And so we have decided to stop serving soda. So no high fructose corn syrup. We're not going to serve soda. Obviously, if patients want it or a family member brings it or we'll have the vending machine, it'll be available if people really want it, but we won't be the one to be serving it to our patients. And so the change of food, using food at healing, food as medicine, and the way that we're serving and creating our food in our menu for our patients is drastically changing for the better. So we're really excited about this.
You're turning hospital food on its head.
Yes, absolutely. Like this is going to be food that people will be like, oh, I really loved the, pasta I had at TGH. Like they're going to be, wanting to go. So, we're really excited about that.
That's great. Great. Rachel, what about you? What's next for you?
Yeah, I would say, I have to plug the TampaWell app. So we launched this back in January. So it's been out now for about 6 months, but definitely something we're going to be focusing on more and more over the next year or so. But really the app it's available to anyone and everyone. So if you are visiting Tampa, you can download it. Or if you live here, that is who we really want to target. But it's an opportunity to create that connection. So it's similar to some of the other wellness apps that you may have used in the past where you can track your steps, track your sleeping habits, learn health tips, read health education articles. But what really separates it from anything else is it's all custom to Tampa. So that health tip you may receive, maybe it's you on a different app would say like, oh, don't forget, get your 10,000 steps in today. But on our app, it will say, get your 10,000 steps in. Why don't you visit the Bayshore Fitness Trail, 4.5 miles that you can walk along our beautiful waterfront. So it's also written by local experts. So USF professors, for example, TGH team members are all providing content for it. We also have a really comprehensive wellness calendar. So again, whether you're visiting or you live here and you're looking to do something healthy or wellness related on the weekend, for example, you can go on here and search and find all these different events. Yoga on the lawn. Maybe it's a local race, Gasparilla is taking place. All of those items can be found on this calendar. But you can also then get rewarded for doing these activities. So a lot of individuals, especially with different organizations, that you have an app at work and you can track your steps, track your wellness, and you get money or prizes. And that's what we're doing, but at the community level. So you can do all these great things, create these healthy habits, and then earn Amazon gift cards. So we are rewarding you for making these healthy decisions. So that is definitely something that we'll be promoting more and more over the next year. Also looking to get more partners on board. So this is something that we've built this platform, but we want others to use it. So maybe you work or you volunteer for a small nonprofit that maybe they don't have the resources to develop their own website or calendar or app. We want to bring them on board as long as their mission is in alignment with ours. And we want them to be able to use this to promote their health and wellness activities to the community. So definitely looking to continue to build that connectivity more and more.
And would you mind sharing your website with everybody?
Absolutely. So, what's beautiful, and I don't know if we can zoom in on this with the camera, but on the backside, it has all that great information. But our website is www.tgh.org/TampaWell. You can also go into the Google Play Store or the Apple Store and just search TampaWell, and you can find our app there. We also have multiple social media accounts. So you can find us on LinkedIn, Facebook, and Instagram just by searching TampaWell.
Great.
Yeah.
Fantastic. I want to close out. I always like to close out by just giving a personal point of view. So I'll start with you, Dr. Sharma. If you could dispel a misconception or an assumption that people might have about the underserved population that you're working with, family and kids, what would that be?
I think sometimes people think that they're not trying hard enough to, get their conditions better controlled or not trying hard enough to, provide a support system for their family. But in reality, these people and these families are working tremendously hard, sometimes 3 jobs, just to make ends meet. And so I think that judgment is sometimes there that, they don't think they're trying hard enough to, get a job or get food on the table, when in reality, they're working extremely hard.
Mm. Interesting. Rachel, what about you? What do you think there's one thing that maybe somebody could do to, in terms of healthcare and wellness and disease prevention? What's one thing that somebody can do to maybe help another kid or another family who might be in need?
Yeah, I think so much of it comes down to access and education. So I think anytime you can have a conversation with someone or just expose someone to something new. So if you are, maybe you have a friend in your classroom who they've never had an opportunity to come to, a fun after school activity or participate in a class, bring a new friend, expose them to something new, make those connections. I think that is so important. I always joke in our wellness setting, I feel like we have certain topics that always come back up because we're all so passionate about it. And one of the things that I constantly talk about is I'm always fascinated that the one thing that all humans have in common, no matter your socioeconomic status, no matter, your race, your ethnicity, your sex, your age, whatever it is, we all have to sleep and eat to survive. And it's something that's not talked about, or really we don't spend a lot of time educating our kids on that in the classroom. So I think that is an area of opportunity to really encourage wellness conversations and wellness classes at those younger levels. So we're able to educate our kids and also start creating those healthy habits young that will hopefully translate into better habits as we move into teenage years or into adulthood.
Absolutely. We all sleep.
Yes.
We all eat.
Yes.
It should be that simple.
Exactly.
Right? Well, you ladies have obviously taken a very complex and very broad topic and really helped us understand it all better. And I really think what you're doing is great. And I know that our viewers and our listeners are going to learn so much. And we just appreciate everything you're doing at TGH and TampaWell. And we appreciate your time.
Thank you.
Yeah, thank you.
Thank you so much for joining us today. We'll see you next time.
Thanks for spending your time with Think Bigger Voices. Visit thinkbigforkids.org/podcast to see more episodes, follow our journey, and stay connected.